Well, welcome. Clearly, after several weeks of this briefing being held on a Friday, the first and obvious question is why has it been brought forward at fairly short notice by 24 hours? And the reason actually is quite simple. It's the interaction between the public health restrictions and the proposed Black Lives Matter event scheduled for this Saturday, and that really warranted an earlier briefing. Today we've actually got a lot of ground to cover. Deputy Salisbury is going to explain where we are in the exit framework. Dr Brink will then provide the supporting public health rationale. The Head of Law Enforcement will speak about the Black Lives Matter event and a few other issues. I will then speak about Revive and Thrive, our recovery strategy for Guernsey Together, before the Chief Executive will explain what all of that means, or what all of this means for public services. Dr Brink will then come back in to cover off one or two related issues before we go to questions. So, with that, over to you, Heidi.
Thanks, Gavin. Now, it was 79 days ago, on the 24th of March, that I sat here and explained to you what lockdown meant. Staying at home, closing non-essential shops and services, and stopping public gatherings. I told you that you could only leave your home for 4 basic reasons: shopping for basic necessities, up to 2 hours exercise a day, a medical need, and travelling to and from work, but only where this was absolutely could not be done from home. I also told you that you needed to keep 2 metres apart from anyone while you did so. The sheer enormity of the decisions we had made earlier in the day really struck home with me that evening, and it's something I'll never forget. I took no pleasure in having to do it. But when I spoke to you then, we had absolutely no idea where things would be in a week's time, let alone after a month. We were concerned about community seeding, we were concerned about testing, and we were concerned with what was happening all around us. Modelling indicated if we did nothing, we would see 1,800 deaths from COVID-19 across the bailiwick. We had to lock down. This was the greatest threat to the lives of islanders since the Second World War. Since that day, we've built up our online testing capacity in super fast time, set up an amazing track and trace team that has hunted down those who could spread the virus, and followed the evidence provided by Dr Brink and her team. But more than that, we as a community have really shown what we're made of. We've punched above our weight. Sadly, 16 individuals have died from the disease, and we mustn't forget that. Each of them will have families mourning their loss. However, because of the whole island's approach, the figure was not worse, and we've been able to control the spread of infection, resulting in no new positive cases for 42 days. Everyone has been impacted by the decisions we have made. Some have had to make terrible sacrifices, in particular those who have been unable to see their dying relatives at the end of their lives. Others haven't been able to run their businesses. Some have lost their jobs, and yet more have had to stay at home for many weeks shielding due to their underlying medical conditions. But we should all be proud of what we have achieved. We've supported our hospital, protected our health and care workers, and saved lives not only from COVID-19, but from other unnecessary deaths had the PEH been overrun. Guernsey Together hasn't just been a catchphrase, it's been a powerful call to arms. The rainbows, the claps for carers, the cakes for the public health team, the support Nikki, Gavin and myself have been given has been truly incredible. The community has come together in solidarity to get us where we are today. And it's because of all that hard work, the sacrifices, the community spirit, that the Committee for Health and Social Care has been able to make a decision on moving to the next phase. Effective from next Saturday, the 20th of June, that is a week Saturday, we will be moving to phase 5. In effect, the bailiwick bubble. All the restrictions in terms of meetings and gatherings will be lifted. Nightclubs can open and businesses can operate as normal. You'll no longer need to queue to go shopping. Restaurants will be able to operate at full capacity, and you can stand at the bar with your mates. We are in effect where we were before lockdown began, albeit we've learnt over the past months the importance of being aware of your distance from others, following hygiene guidelines, and staying up at home if we're feeling unwell. All of which will stand us in good stead over the coming weeks. The only restrictions that will remain will be in relation to the need to self-isolate in specific circumstances, including when travelling back to the bailiwick, and Nikki will speak more about that in a minute. Now, I know some of you will be asking, why can't we move to phase 5 now, from midnight Saturday, this Saturday? Well, we shouldn't forget that the state schools have only been open to all pupils since Monday. In line with previous public health advice, we need to see how things go, even if we haven't had any new positive cases for a while. We have also learned over the weeks how businesses need time to adjust to any new changes, and law enforcement need notice to ensure they are prepared and can liaise with businesses involved in the nighttime economy in particular. By telling you now, we can see how things are going in the schools, but also allow businesses to be prepared and ready at the earliest opportunity. Finally, we've been aware that there has been an understandable desire for many to show their support for Black Lives Matter by attending an event that had been organised for this Saturday. Of course, as the law currently stands, it would be an illegal gathering. Some have contacted us about it, expressing their concern because of this, including those who would like to attend such an event but didn't want to break the law. However, I am very pleased to say that the organisers, having been given advance notice of our decision yesterday, have agreed to move the event to the following Saturday. We are very grateful to them for doing this and showing their commitment to Guernsey Together. It epitomises what I've seen over the last few months, and I would just like to finish by saying thank you to everyone for what you have done to get us to where we are today.
Right, thank you very much, Heidi. Nikki.
So thank you very much. So we're day 42 now with no new cases. So again, another momentous day for us. It's really been incredibly encouraging. And we're moving to phase 5 in advance of where we thought we'd be. So we're moving to phase 5 on the back of the fact that we've got no cases for 42 days, and that's why we're moving early. You may ask, why don't we just move on to phase 6 and open up the borders, have no quarantine, no compulsory self-isolation? The reason being is in all the jurisdictions around us, there's evidence of ongoing viral activity, and we need to be cognizant of that. Also, as we open up the bailiwick, we're massively increasing the number of contacts around the bailiwick, and that's really important for us to consider as well. Phase 4 has been extremely successful, and I wanted to pause here and pay tribute to the teachers. Opening education, the teachers, the parents and the children have engaged magnificently with the process. And really, I've never met such a group of individuals, the teachers. It was a really can-do attitude. It's let's get this done. It's in the best interest of our children. And that was extremely rewarding from our perspective. So we were very pleased about that, and we would say thank you very much to everyone who worked so hard on that. I think I'd also just like to touch on, with regard to the moves to phase 5, is the issue of surveillance testing. So as you're aware, we've got very few symptomatic people left, so we've got far more tests available than we have symptomatic people. So what we did is moved ahead with the expanded surveillance strategy early, and we've now tested almost 700 people, and we've found absolutely no evidence of infection. This is the direct viral test. So every group we've looked at, whether they're health and care workers, we've looked at Aurigny cabin crew and pilots, we've looked at care workers in the community, we've looked at primary care, we've found no evidence of infection in those groups. And that, again, is really encouraging, and it's given us the evidence, and you know how I like evidence, it's given us the evidence to progress more quickly to phase 5. So phase 5 is essentially going to be our new normal. So there are going to be no restrictions on, for example, the size of gatherings. There will be no official social distancing, so no 1 or 2 metre controlled versus uncontrolled environments. But we will be saying to people, let's learn the good lessons that we've learned. So let's respect personal space. So we know that the closer you are, the more likely you are to transmit an infection to another person. So respect personal space. Hand hygiene, respiratory etiquette, so the catch it, bin it, kill it, all of those things are so important as we move to that new normal. So I think it's a really exciting, it's a huge milestone for us, but the whole of the bailiwick will be open. Now, one of the things, and I want to particularly say thank you again for the patients is the people running extracurricular activities for children. Now, we've had a lot of questions with regard to that, and rightly people saying, come on, can't we just get on with this? And I had a lot of sympathy. And I'd also like to say thank you to the people who phoned, and some of them I spoke to, and how understanding they've been. Now, the reason why we paused on extracurricular activities when we opened the state schools was what happens with extracurricular activities. You get lots of different schools and lots of different year groups mixing together. So it was just to try and have that measured approach. And so with Phase 5, all extracurricular activities will be open as well. So I think that will be very welcomed by large sectors of the population. The other thing that we've had a lot of questions about is antibody testing. So antibody testing, obviously important, and we're going to be starting our antibody testing next week, starting off with health and care workers who've worked on the front line to see how many of those are antibody positive. But also we're going to be offering testing to those in March and beginning of April who had clinical symptoms suggestive of COVID-19. But as you are all aware, at that stage we were limited by the number of tests we could do because we were required to send the samples to the UK. So now we've got the antibody test available, so we'll be doing it on those groups of individuals. So lots of progression with regard to the testing and also with regard to the progression to Phase 5. And again, this couldn't have happened without the entire community of the bailiwick, and we're incredibly lucky from that point of view. Thank you very much.
Great, thank you very much. Rory.
Thank you. I think we all stand alongside across the globe those people who are appalled and horrified by the way George Floyd lost his life, and we all wish to see justice and accountability follow. We fully understand people within the bailiwick wishing to show their support for this global movement, and I would like to also express my thanks to the individuals who are putting the event together for how they've listened and how they've engaged and how they've listened to the advice from public health. And the role of law enforcement now is to work with those individuals to make sure that the event on the 20th is a successful and safe event. And of course now it's open to far more people should they wish to join it. So we're very, very pleased that we've managed to keep our local restrictions intact and that this demonstration didn't take place in an unlawful way. And of course any such gathering over 30 before the 20th would still be unlawful. So it's a very important point we need to make. With respect to the people arriving within the bailiwick, we're still maintaining the 14-day isolation checks, and staff from the Guernsey Border Agency are working very hard in that area, as well as meeting and greeting an ever-increasing number of passengers, making sure that they are fully briefed on the requirements of isolation. We're also there to ensure the welfare of individuals who are in 14-day isolation, because we do accept that it's quite a challenge for some people. We also make sure that those people in isolation have access to the correct medical pathways, and if they have any issues or problems, we're ensuring we can feed the appropriate agencies to help them. But also an important role is to ensure that people are complying with self-isolation, and that work is still ongoing. Currently there are 421 people within the bailiwick who are subject to self-isolation, and we've undertaken 290 telephone and other contacts, as well as 37 visits with people in isolation over the past week. So I'm grateful to all the staff undertaking that really important element of keeping the bailiwick safe and secure. Thank you.
Great, thank you very much. Yesterday we published our high-level recovery strategy, Revive and Thrive, and it's going to be debated as a so-called green paper next week in the states of deliberation. And following that input from state members through that debate, there will then need to be dialogue with business and third sector groups, and then 3 recovery action plans will be prepared, one for sustainable economy, one for health and care, and one for community, which would include, for example, education. In the short term, we will deliver on the air and sea links reviews which have been going on and decide what Orreny's role is to be in our future. We will start to invest in the enhancement of the seafront area, We will decide what the role of 5G is to be and what our telecoms infrastructure needs are, particularly in light of the recent COVID experience. And we will deliver on the review of the population management regime. The objective is ambitious, but it's clear. It is to recover 2020's lost economic output in 2021. It is to capture the best parts of the lockdown experience, to improve our environment and all our health and well-being. It's to deliver improved infrastructure, and it's to deliver a stronger but more sustainable economy with higher growth rates in 3 years. And it's recognising the linkages between the economy and the social and environmental issues that we face. They are all interlinked, and we can't solve one without the others. We obviously had many challenges before COVID-19, not least, of course, climate change. And we have even more and even bigger ones now, including the trashing of our public finances. But counterintuitively, I'm actually more optimistic than I was 6 months ago, because actually with determined leadership and a new community cohesion and strength, I know that we can do it. And why do I know that? It's because we've seen what we can do together. We've seen that in the last few months. We can be global leaders, and I know that too because we already are. We will need to continue to be bold. We will need to think big, and we will need to be brave, and we will need to be prepared to invest. And we will also need to move at COVID speed, which we've learnt to do. And Nikki was talking about that in the context of the can-do attitude of the schools, and not at normal state speed. So, frankly, let's just get on and do it. Today's announcement of a move to Phase 5 from Saturday the 20th is hugely important. And back to global leadership, we will be the first place in the British Isles and one of the first in the world to remove all restrictions, including social distancing. And I think that is just such a huge testament to, and frankly, a reward for the whole community's effort that both Heidi and Nikki have referred to in working together and all the sacrifices that have been made in the last 3 months, and for which we can all celebrate and be rightly proud. And I hope, there have been a whole range of events cancelled in the months ahead, and weddings and a whole range of other things. And I hope that some of those, it may be possible for those to be rearranged with the move into Phase 5. But whilst we can celebrate and we should celebrate, as I've said before, and frankly I really don't mind repeating myself on this point, we cannot be complacent. We need to remember that this virus is still raging around the world and is still gathering strength in some locations. So far there have been 7.4 million reported cases and 418,000 known deaths. The number of new known cases reported globally daily reached a new record high on Tuesday this week of 136,000. So we are, and we will continue to plan for a second wave. And if it comes, we will be ready. And if it comes, we will all need to be prepared to accept the reimposition of some public health restrictions, starting, of course, with social distancing. I want to add my own personal thanks to those organising the Black Lives Matter event for postponing for a week until Phase 5 has begun. The issue that they are seeking to highlight, as Rory has said, is hugely important. And I know from my own engagement with the local victims of discrimination in the last 10 days or so, it's sadly very real and actually very present in our own community. But it is an issue that is not going to be resolved in a week. So I'd like to commend the organisers for their decision. It is a highly responsible one, and more importantly, as Heidi said, it's deeply respectful of the community and the Guernsey Together spirit that has carried us so far in the last few months. And I know, like me, there are many others who want to be able to attend a lawful event and will be pleased that we can now do so. We will plan to meet again next Friday at 1 p.m. In the meantime, please do remember that we are still in phase 4, and so let's not all jump the gun. The same social distancing rules do apply for another 8 days. If you can, continue to work from home, as I and the States will be doing. And of course, as Heidi has said, stay at home if you feel unwell. As Nikki said, keep washing hands and the catch it, kill it, bin it. With sneezes and coughs, all those messages. These are the public health messages that will not change in phase 5. They will not change in phase 6, and they very much are our new norm that we all need to get used to. So with that, it's over to Paul. Paul.
Thank you. As highlighted, today is another day of positive news as we move more swiftly towards phase 5. Moving through the phases swiftly has implications for private, voluntary and business sectors, and indeed the public service. Through phase 4, whilst operating, we had to make the choice to keep all the core administrative states buildings closed to the public and adopt working remotely from home in many cases. All services have continued to operate throughout, but we do appreciate that whilst there is online provision in a number of areas of customer service, the pandemic did arrive during the midst of a digital service transformation programme, and areas remain where our online and digital alternative is not as advanced as we'd like, as we have rightly focused on the attention of managing the crisis. We've been taking this opportunity to take stock, prioritise development and bring in technology like the virtual call centre. Moving into phase 5, we will be reopening customer-facing counter services where the online provision is not yet available, possible, or of an acceptable standard. Most notably, driver and vehicle licensing in Bulwer Avenue will be open to the public from this Monday. In some areas, we'll also be moving to an appointment rather than drop-in system as a result of the increased uptake in online services. Further details will be published tomorrow. While the rapid advancement of phase 5 will have a positive impact for many businesses, we are currently working on proposals for maintaining business support, particularly for those sectors where the impact will continue to be felt at least until phase 6 and potentially beyond. In particular, those who work in our tourist sector. We have been working with the business to understand their position and what support they might need going forward. I would like to emphasise a couple of points made by Deputy St Pierre. The recovery strategy is published ahead of the State Assembly. The outcome of this will shape the support needed from the public sector to deliver upon it. But we can build on our approach to COVID-19. We look forward to continuing to work in a way we have been with the community during this crisis. True engagement and input across the business, the charity sector and wider community will be vital so that we can all be part of the bailiwick recovery. Building the detailed action plans together, just as we have been in a response to COVID-19. Guernsey Together is what has brought us to this point, and if we can hold on to that practice going forward, it will be the key to our success. I'm sure it won't have missed your attention that we have been the subject of significant national media interest in the last couple of weeks. Again, my thanks goes out to our small communications team who have worked tirelessly to optimise this opportunity to keep us on the national and global stage. We could not dream to afford this kind of advertising opportunity for our bailiwick. As noted by Deputy Salisbury, this not only demonstrates how well we can punch above our weight, it also bodes well for our future in being such a positive spotlight. While we wait to reap the rewards of this, I encourage all of those of you who are able to support our friends in the hospitality sector by booking a staycation or indeed going out for a dinner. We are the envy of many. There are few better places to enjoy a staycation or eat and enjoy refreshments in the most fantastic venues we have in Guernsey. Please give them our support. This has and will be a particularly tough time for this sector.
Great, thank you very much. Nikki, I think you covered off some of your odds and ends, didn't you?
Yes, there was only one other question that we've received a lot of questions about immunity passports. And I think it's really important to clarify that. As the World Health Organization, and in fact, most of the bodies that we engage with, for example, Public Health England and so on, don't recommend immunity passports. We simply don't know whether the presence of antibodies means that someone is immune to an infection. So this is a recurring question that we're getting. So we don't recommend that we use antibodies as a form of guaranteeing immunity. We can't say that that person isn't susceptible to a second infection. We think it's unlikely, but we're not sure. And on top of that, some of the tests are not don't perform as well as some of the other ones. So we have to be really careful about that. So the current recommendations are that we don't use immunity passports. And this is something that we're getting quite frequently in our public health inbox. And I think it's just important to be proactive and explain to everyone why we don't recommend them at the moment. Thank you.
Thank you very much. Okay, so we'll throw it open to questions. Who'd like to start? Yes.
Hi, Zoe Fitch from the Guernsey Press. Has there been any progress on the thought of air bridges or travel corridors to countries with low rates of COVID-19?
No substantive progress is the honest answer, but we are seeking engagement with a number of jurisdictions that have low prevalence. So we'll see where that emerges or what develops from that. But I'm afraid I've got nothing really more that I'm able to say at this point. Ewan.
Ewan Duncan from BBC Guernsey. Just to follow up on Zoe's question, the recovery strategy yesterday obviously talked about using Aurigny as an economic enabler and perhaps focusing Aurigny's needs on what islanders want to touch on the air bridges. Could we see some routes open up to countries that Aurigny perhaps hasn't gone for that might be suitable?
Personally, I think that would be great if that happens, particularly in the short term. I think particularly if the community has been in this, in this state of lockdown and has the opportunity to go somewhere that we consider to be safe to do so, then it would certainly in the short term that would be fantastic. But yeah, as I say, in response to Zoe's question, it's a little bit premature, but it's something that we're all conscious that if we could achieve it, it would undoubtedly, I think, be welcomed.
And all our focus now will be on phase 6, the borders travel, and that will be part of it.
And importantly, in relation to that, it's developing a similar framework that we've had in relation to the exit. We need to have a framework in relation to travel and borders so that, again, there's clarity about the decisions that are being made and it's understood what the rationale is. So that's something that is being actively worked on. Next question.
Hi, it's Lisa from ITV. You said that there's an ever-increasing amount of people coming into the island. Is Guernsey looking to implement the 24-hour testing like they are in Jersey? And also, we've been told by a taxi driver over here that they're having an increasing amount of people coming in and who are booking taxis to be taken home. How are we policing that, and how are people being shown that they're sticking to public health guidelines, and that the taxi drivers as well are also doing that?
Okay. Well, Rory, do you mind dealing with that second part first, and then
Yes,
perhaps
means,
Nikki, if you
yes.
could address the question of testing
Okay.
after 24 hours or 24 hours.
When anybody arrives in the bailiwick, they're met by border agency staff who give them a very clear briefing as to the expectation of the 14-day lockdown has to be. Of course, they've got to get from the airport to their residence, and some people do use and book taxis. And there are clear guidelines for how taxi drivers should be cleaning their cars between passengers and taking good public health advice around minimising any spread of the virus. So clearly that to date has worked well. There is no evidence that there has been community seeding. Clearly people have to get from the airport to wherever they're isolating. I don't think I can answer it any further than saying that the follow-up visits and the work done by the border agency during that 14-day period is done on a risk-based approach, and please be assured that any individuals that we view as high risk are receiving the attention that's required to ensure that they're complying with the isolation. Indeed, there are a number of investigations that have been going on. I'm aware of one where there was an allegation against an individual and we proved beyond doubt that that person hadn't breached. So it's an important aspect of work, and please be assured it's being done fairly and appropriately.
Right. Testing.
Right, okay, so testing. So if you look at testing someone as they come into the bailiwick, you've got to think of the incubation period of the virus. The incubation period of the virus is 2 to 14 days. So if someone is infected in transit, So catching the train down to Southampton and Southampton Airport and then arriving in Guernsey, you will miss 100% of those cases if you test them on day one. Okay, because of the incubation period being 2 to 14 days. So it's 2 to 14 days with a peak of 5.2 days. What you will get by testing at the airport is you'll get the people that have been infected some days prior to travelling. And so I think it's really important if you consider, and we consider the most risky part is the passage through public transport, sitting in an airport, mixing with people from different destinations, perhaps being on a crowded train going down to the airport. That, if you consider that as a likely time of infection, which we do, you'll then miss, if you test people on day one, you'll miss 100% of those cases. So I think you've got to be, with any testing, airport testing strategy, you've got to be absolutely clear what you're trying to achieve. And if you're trying to find people that might have been infected more than 2 days before travelling, then yes, that'll potentially work. It'll miss quite a lot unless you go up to 5.2 days before travel. But if you're trying to get the people that are infected whilst they're transiting through the airport, you will miss all of those. Now, there are other jurisdictions where the travel to that jurisdiction might take 2 or 3 days. So if you're doing a long-haul flight, doing lots of changes, you might end up travelling for 2 or 3 days to get to that particular destination. Then that might pick up some of the cases. But I think you've got to be absolutely clear what you're asking for. And I think with every strategy we've put in place, we feel we owe it to the people of Guernsey to say, this is what we're doing and this is the science behind it. Because I think it enables people to understand and sign up to the strategy. So I hope that answers your question. It depends on whether you're looking for infections sometime in the past or whether you're looking for infections in transit.
And that's why we're developing the framework, so that it can be explained and understood by all. But it simply hasn't been the priority up to this point, because the priority has been getting us to this point, to be frank.
Can I just pick up one point? So we're talking about people travelling from the airport to home. They should be wearing their mask continually from the moment that they've got on the plane to the moment that they get home. Had heard anecdotally that some people haven't been doing that, but that's what should happen.
And sorry, just one further point. Part of the work we're doing about people in self-isolation is they feel unwell or they have any symptoms, we feed them very, very quickly into public health for the appropriate tests and checks. So, there's a system there that really encourages those individuals to get that medical help and advice at an early stage, which allows Nikki and her team to make a proper assessment.
Okay, all right.
Different question now, actually. Laura Clayton, Bailiwick Express. So, Deputy Soulsby, you just said that people should be wearing their masks until they arrive at home. But I believe we were told that actually wearing masks from when you check in at Southampton Airport was advised. It wasn't mandatory. So what can airport staff in Southampton or Guernsey do if people actually just aren't wearing those masks?
Well, they can point it out for a start that they should be doing it. No, it's not. We haven't set it in law, and I think it's a very difficult thing to be able to manage it from that point of view anyway. But no, I mean, it's something that we are asking people to do as part of their, public duty in supporting the whole of the community. So really, people, if they say you should be wearing a mask, and then they should do it. I mean, it's about working together again, isn't it?
And taxi drivers indeed can ask their passengers to wear the mask. They would have been travelling in one, so they should have it with them. Yes, sorry.
I had another actual
please,
question.
Yeah.
Okay, so we're going into phase 5. We're preparing for a second wave, and we've been told previously that we are expecting there to be further positive cases, particularly with more people travelling to the island. Do we know yet what the trigger points will be for any of the lockdown restrictions to be reimposed once we've gone into phase 5?
Yeah, they are set out in the exit framework. So it's in terms of numbers of cases of unexpected community seeding, if we've got clusters of infection that we're concerned about, and other things around that which might... the hospital being overrun. Thank you, Paul. So there are a number of triggers that will result in that. We're not saying, oh gosh, if we get 2-3 new cases, we're going backwards. We're not. And I know we've been with no new cases for like 42 days, but that was never our goal. You know, we've just exceeded our goals from that point of view. It's being able to manage those cases. So 2-3 cases, it can be more than that. It's so long as we can contain it, make sure that Nikki's team immediately can test, track and trace, and that will be our future. And especially with the new expanded testing facility, it will make it even better, I think.
Yeah.
Nikki?
I mean, we've got 4 scenarios that we've planned for. We've planned for individual cases occurring. We've planned for clusters of cases. We've planned for a second wave, and we're doing our winter planning. So those are the 4 scenarios we're looking at now. And going back to January of this year, we looked at this virus that was occurring in Hubei province, and we didn't like what we saw. We thought from January this virus had pandemic potential. And now we're looking at those 4 scenarios. And it will depend. I mean, we think we will be able to cope with even small clusters of cases because we have our on-island testing. We have a very well-proven track and trace system. By the time we got the first case on the 9th of May, we were sitting waiting for that case. We were trained waiting. So we knew that we were going to see that case, but now we have a track and trace system and a contact tracing system that's actually been proven to be very effective. And that's a 24/7 service. So we aim to start contact tracing within an hour of getting a positive result. And that's part of the efficacy. So all of that. So we think we will be able to cope with cases. And as we see more connectivity, we're expecting cases. But again, we're ready and waiting.
So when we said we're planning. When we said we're ready, we will be ready. Next question. Ewan.
Just a quick word about social distancing. Obviously, the schools have gone back this week, and by the time we're in phase 5, they'll be back for a couple of weeks. What will be the arrangement at school? Be much like before the pandemic?
Yeah, I mean, the arrangement will be more akin to before the pandemic, but what we want to try and do is keep those good lessons we've learned. So actually don't crowd on top of each other, you know, within office areas, you know, respect each other's physical space, look at hygiene, you know, look at hand hygiene in children and so on. So we're hoping to really take those positive messages forward, and that will help us with our winter flu season and all the winter bugs that we get. So it'll be a new normal because what we want to do is make it better. So it's revive and thrive, and we really want to try and thrive and make everything a healthy environment. So things also that we learned from the pandemic is what we're trying to promote going into schools, things like active transport. So really just relook and see at how we can do things better, you know, and I think we've really got a chance to do this. And I think there's a lot of appetite within education, within the schools, to really move this forward.
I suspect there'll also be lots of requests for Dr. Brink to take part in PHSE lessons.
Okay, Lisa, then Zoe.
What does phase 5 mean for those who are currently shielding? Do they still have to? And do patients going to Southampton or to the PH, will they still need to self-isolate before operations?
Yeah, so they're looking at the whole self-isolation before operation. So that's been looked at by our medical director. With regard to people who are shielding, I go back to, I have never felt this is a one-size-fits-all. And I think there needs to be a degree of personal decision-making in connection, in consultation with the person's doctor. So if you have someone who's shielding, we're day 42 of no new infections, and that person might feel, well, I don't actually want to sit by myself in a room indefinitely, which, I mean, people in the UK are being told to shield for far longer. We're in a different situation to the UK. So I think I'd advise people to consider their condition, to discuss it with their doctor, and then make a decision on the basis of that. I don't think it's, will you fall into a shielding category, bad luck, you need to stay indefinitely. I think we need to have a degree of individualised care here, and I think that's really important. And we've always tried to treat people as individuals and look at their personal circumstances. And even when we've been asked for advice, for example, in people that are in self-isolation, we've tried to actually look at people's individual circumstances and do something that suits them. And I think that's really important. So I would say not everyone would have to stay in self-isolation. I think people need to be cognizant if they're above a certain age or have a certain medical condition, should they come into contact with COVID-19, the virus that causes COVID-19, they're at a higher risk. But I think people are quite capable of making those decisions.
Just in relation to the Southampton point, of course, if people are going for treatment in Southampton, that of course is subject to the NHS England requirements.
Yes.
It's not a Guernsey requirement, is it?
No. So it's 2 weeks self-isolation before they go. So that is an NHS requirement, but our medical director is actively engaging with Southampton.
Okay, thank you, Zoe.
So in phase 4, it was still advised to work from home if you could. What advice is there for businesses who would look at getting staff back into their offices as of phase 5 in case there is a second wave and we have to regress back to an earlier exit phase? Should everyone feel comfortable to go back, or should some staff hold off on returning?
Well, it's phase 5. We basically said that what the risk is, and it's returning to a new normal. So we're not telling people work from at home if at all possible. What businesses might find is that their working practices might change, and they actually think it works for them better, and that some people can work from home. I think for some individuals, working from home might suit in terms of their own life and requirements. It might make more sense. So it is an opportunity for business to revisit how they work and see how they can support their employees as well. But there is no public health risk stopping people from having to going back to work in an office. The risk, yes, as we say, that the possibilities of going back a phase are there, but as we're saying, we're mitigating all that risk through, at the moment, the border controls, but also the test, track and trace that we've really beefed up. So that's what we hope to minimise, and so we don't go back there. And so really, phase 5 is phase 5.
But just to emphasise the point that it really is an opportunity in the context of Revive and Thrive, actually for not only for government but for everybody to be thinking about how do we capture some of the things that we've learned from this experience. And I think Heidi's right, the employers may well decide with their employees that actually it makes good business continuity sense and planning for them to have some people working at home, particularly in periods of influenza, for example, as we head into the winter season, or if they've got employees who've got particular underlying health conditions, it may make sense for them to continue to work from home during certain periods. So this is all part of, let's take the learning experiences and apply it into the new norm. So we'll go to Laura and then Ewan.
As we head into phase 5, what's the situation with island care homes at the moment? Is it pretty much life back to normal for residents and staff there? Is the specialist cell that was set up, is that still in operation?
Yes is the answer, and we still want to look at the visiting in care homes and so on. So they've set up schedules for visiting in care homes, so that's something that's been actively considered by the care cell. And what they will do now in phase 4, we set up the booked visiting appointments and so on. What the care home cell will now do is look at phase 5 and specifically do a risk assessment on care home matters as we move into phase 5. And I think that's really important that we consider all of these things together, but also acknowledge that we know that people over 70 and certainly over 80 are really vulnerable.
Can I just add?
Yeah, of course.
I just wanted for absolute assurance, and it's been touched on a couple of times this morning, that there could be a second phase, which is not unusual for pandemics, and we've said that we are planning. Deputy St-Pierre said we continue to plan and we will be ready. And just to give that absolute assurance, there's an absolute army of staff formed in cells, strategic groups that have kind of optimised and specialised around certain aspects of work. We aren't letting them all drift away and lose what we've already learnt. Whilst we'll ease off on those structures because we've got to get on and celebrate sort of business as usual, actually they will all be stood to, ready and planned if we have to upskill them and get them in place again.
Great, thank you. Ewan.
Just a quick question about the recovery strategy. You already mentioned that as part of that it will be to improve our environment, and Dr. Brinks just touched on the fact that our young people are engaging in more active ways of travelling to school. How important is the environment in Guernsey and the bailiwicks environment going to be in the recovery strategy to improve our lives and to improve island life?
My personal view is I think it's very important. I think it's as I said when I spoke earlier, social, environmental and economic, they're all interlinked. And I think that's what we have learnt and seen more clearly in the last few months than before. So, you know, we've been very used to seeing them in pigeonholes. And I think the interconnectedness of them all, I think, you know, we've sought to represent that in the strategy. You know, we need to it's underpinned much of the thinking around the Health Improvement Commission and active travel and all of these things that over the years we've been trying to recognise that having improved opportunities for people to maintain their own health is clearly a benefit to them, but also benefit to our economy and to the health system. But to do that, they need to have the right environment to be able to do it. So that we know that we've known this for a while, but now we have to deliver on it. That's what I would say.
Yeah, well, I'd just say core to that, the partnership purpose is core to the recovery plan. It is part of the recovery plan because it is not a plan, it never has been one that is just owned by the Health and Social Care Committee. It links the whole of government and beyond because it is a community plan to enable ourselves to have a model of health and care that meets people's needs. And that doesn't just mean whether they need an operation or whether they need to go to see a doctor. It's about the wider determinants of health, making sure we know that people who are less wealthy have generally less healthy than others. And Gavin is absolutely right. It all interlinks. We've seen the work that's been done by Sir Michael Marmot in the UK on that very subject and actually showing the impact of COVID-19 in the UK. It's adversely impacted those who are from less privileged backgrounds than others, and we need to understand that for the future. This is why we really need to take on board the recovery plan. It's not just about the economy, it's got to be about consideration of those wider determinants of health, which will make us a better place to live.
And in terms of our environment that we actually live in and the wildlife we have around us, how much priority has to be given to that? There are plans obviously to alter some of the island and regain some land, but do we need to rethink those ideas?
Yeah, I mean, I think I'm in danger of repeating myself. I think, yeah, I mean, as I say, I think the environmental issues and addressing climate change, for example, and the impact of that and biodiversity, you know, these things are not, they're not a topic that you can just look at in isolation. I think we have to learn to look at them together, and that's very much what this is aiming to do. Next question. Any other questions? Yes, go on then.
You mentioned earlier determined leadership, which I think we can all agree we've had for the last few months, but there's an election looming very soon, and as life gets back to normal, do you think you will be able to move forward with the support of the states, members, the public? You know, will we keep Guernsey together, or will we see that all start to fracture?
So that's the $60 million question, the £300 million question, or whatever. I don't. The answer is I don't know. I mean, there's clearly a lot of politics to flow under the bridge, as it were. We need to see what happens to the strategy when it's debated in the States next week. We need to decide when we're going to have the election, whether it's sooner rather than later. My own view is that I think we do have an opportunity now. We have a window, clearly. As we've said earlier, who knows, there may be a second phase that we need to prepare for, but clearly we're in a good place now. I think we're in a position to hold an early election, and we should get on and hold it, and that will then allow us to reset and decide, you know, how we want to drive this community forward over the next 4 years. That's my own personal view.
Yeah, I mean, I think what is important is whatever people and how it's debated and what people think. I think everybody needs to get behind the recovery plan when it's approved. I think that cohesion and that solidarity and working together, because if we don't do that, I think it will be harder to recover and it will take longer. I think we've got to make that decision. Again, it's making decisions based on the evidence and running with it.
Any more, Ewan?
Thanks for all your work so far to get to phase 5 shortly, but obviously now the attention will turn to when we can move to phase 6. What are the likely triggers that we might see, probably from outside the bailiwick, of course, that will enable us to move to phase 6?
I don't want to speculate too much on that because the policy decisions haven't yet been taken. We need to have input clearly and advice from public health and the public health team, and then that needs to be shaped into, as I say, a clear travel border framework that we can then share publicly, and there will be an understanding of what the triggers may be. Again, going in, in relation to the previous question, going either way, going in and out of tighter border control. So those decisions need to be made. I'm conscious that if we don't have that kind of framework, then we will end up either making ad hoc decisions or be seen to be making ad hoc decisions, neither of which are welcome. But I mean, the obvious things, clearly, the obvious challenge, and I've said it before, and Nikki will agree with this, is the prevalence rate at our major destination of origin at the moment, which is obviously the UK, is and remains the highest in Europe. That remains a significant challenge. Again, whatever framework we have, so long as that case remains, then that's an issue for us. So I think it will be something about prevalence rates and reinfection rates and understanding risk and how we can manage and mitigate that risk. That's ultimately what we'll be seeking to do. And as Nikki said, having testing regimes, understanding when they would be applied and how it would help us mitigate that risk, that's really what the framework needs to be doing. But those decisions haven't been made, but when they are, we will obviously share them as we have done up front. No, nothing else to add to that? Okay, next question. Yes, Lisa.
Just one more on the travel sort of aspect of things. You said in the past that you were in early stages of talking to your Jersey counterparts about some sort of interval in travel. Is that part of phase 6? Is that still ongoing, and where are you with that?
We haven't had any further discussion, certainly at the political level, in relation to whether there's an opportunity there. I mean, I know Jersey themselves are moving further through their own exit strategy. But as I say, I think the decision in Jersey, the decision in relation to travel to and from Jersey should, in my view, be no different from any other destination. It needs to be made within the context of the same discipline, the same framework, the same evidence base, the same understanding of risk and how we can mitigate it. So until we have that, there isn't really much more to be said about that. Any more? Yes? Laura.
I don't believe Aurigny has given any updated messages recently about when it intends to increase its schedules. So with the majority of Aurigny's services grounded, presumably Aurigny is going to end up costing all of us more money. Is it just an endless blank cheque for Aurigny, or is there a limit to how much the taxpayer will underwrite it by?
No, as I said, one of the things that we need to deliver in fairly short order is, and is one of the actions in the recovery strategy, is a determination of what the future of Aurigny is. And I think that's, it has been something that's obviously been kicking around for a number of years without a clear decision. This whole situation is a massive catalyst for reaching a decision on that, because it's clearly changed networks, it's changed the whole travel industry and the whole travel sector. So we need to bring that to a conclusion and decide to what extent we are prepared to continue to bankroll it in whatever size, shape and form and for whatever purpose. Again, I can't say any more about that, simply because those decisions have not been made. Any more?
It's a nice positive one to end on, maybe.
I don't mind.
We've seen lots of people doing lots of great things for charity over the last few months in particular. I know people always are doing good things for charity, but I think I saw a tweet, Deputy St Pierre, that you're running the Father's Day half marathon, even though it's been postponed. Why are you doing that?
Yes, I am. I'm running it with a friend. Just obviously, at the time I made the decision, I didn't know that we'd be moving into phase 5, and therefore group events are theoretically permissible. I mean, it has been postponed. We're going to run the course anyway. I'm going to run it to raise money for the 2 appeal funds. I'm not a particularly great distance runner. I've only done one half marathon before, but I'll give it a go and see what happens. But yes.
It's funny because I was going to do it as well. My cousin is a keen runner in the UK, had already booked travel twice and had it cancelled before all the lockdown happened. I don't know if she'll be able to make it for, I think it's September, is it been October? So hopefully, you never know, and I would love to see her again, because we don't often get that chance, but I would really love to be able to run alongside her. She's a better runner than I am. I'm not the best runner in the world, as you know. Yeah,
I won't be doing it.
But yeah, hopefully, something to to know. Just hope things go well in between now and then, and we can see each other again.
Good. Time for one more. If anyone's got one final one. Go on, then you.
Go on, I'll finish this off, why not? Just a quick word about vaccines and where we might lie with that in the future, Dr. Brink.
Yeah. So they have the news on the vaccine front is slightly more encouraging, and we were initially thinking first, second quarter of next year. There's just a possibility that it might be earlier than that. What we're doing now within Guernsey, and you know how much I like to prepare for things, is we've got a vaccine group together. So we're looking at what a vaccine would look like in the bailiwick, how we administer it, what the logistics are, what equipment we'd need, what cold storage we'd need. So we've already started working on that, because if a vaccine becomes available, we don't want to then start working on all the logistics of it. We want to be ready to actually administer it. So we're thinking about how we'd administer it. If it's a live viral vaccine, there is a chance that it'll have to be administered using PPE for the people administering it, so we're considering all of that. So these are all of the things. Whether we will need PPE or not is another story, but we're planning for all of that as we speak. So we've got a dedicated vaccine group, vaccine cell together, and we're going to be looking at, well, we are looking at that in great detail. We're very fortunate in the bailiwick in that we are allowed observer status on the Joint Committee of Vaccine and Immunisation, so we're hearing all the decisions as they occur, and that enables us to make sure that we're at the front of our own planning. And so that's what we're doing at the moment. So it's more hopeful than it was, but it's by no means a done deal.
And the only other thing I would add in relation to that is, at a political level, we've also engaged with counterparts in the UK to make sure that, again, in terms of thinking about things like supply chain for vaccines, because clearly, as and when it does come, production will need to be ramped up, and there will need to be decisions made as to who it goes to first and so on. But again, we're engaged in that process so that we're not, if you like, at the end of the line, which is obviously important that we have what we need that's appropriate for our community, based on the best advice at the time. So we're engaging at that political level as well.
And simple things like, if we had to take delivery of X number thousand vaccines, do we have enough fridge storage space? So it's those basic logistical stuff that we want to, again, be completely slick, that when it comes, yes, we arranged, we've got everything in place, and we're ready to go.
So it's a good opportunity to emphasise the message that we're always planning.
We're always planning.
Good. Excellent. Thank you very much. So we'll plan to see you again a week tomorrow, Friday week at 1 p.m. Thank you very much indeed. Thank you.